Okay guys, we're continuing the series on Alzheimer's dementia. We're going to do a number of videos on this, how to prevent it, things that the science is now showing us in the medical literature, how we can prevent these diseases. So we certainly need a cure for those who have it, but we need to be preventing it. And we need to be talking about how to do that. So for decades, amyloid plaques, tangled tau fibers, that's been the focus. And so now, when at the Alzheimer's Association International Conference, they're bringing things out. These are some of the things: genes, brain injury, clogged arteries, inflammation. Now, brain injury here. So we ask all patients, have you had a closed head injury at any time in your life? Because if it does, there might be some other symptoms related to that. And sometimes you might need some nutritional support for that. Clogged arteries. If you're not getting the blood to the brain like you should, that's obviously a risk factor. So there's nutritional considerations for that. Supplements high in P factor, which is a part of vitamin C complex, which give vascular integrity. That was shown by Harvard, and I think it was 2012, combined against 5,000 other compounds, and they said the P factor is better than anything else for our vascular integrity. So very important. Inflammation, extremely important. So we've got brain span now. We've had it for, I don't know, maybe 10 years, somewhere around that, where we can take a couple drops of blood, send it in. The patient can do a cognitive test on the computer too. We can see a lot about the brain, and we can start saying, let's be preventative nutritionally and see what we can do to change. So you see omega-3s, you see omega-6s, you see an inflammatory index, you see DHA levels, but the inflammatory index, what I'm talking about now, should be 2 to 1, 1 to 1, maybe 3 to 1, but we're seeing 25 to 1, 50 to 1, 80 to 1, people that are really inflamed, and it's not hard to bring that down to where it should be. So BrainSpan has helped us a lot of that. Things we can do to prevent dementia and Alzheimer's. You do not want to end up in a nursing home. That's about the worst thing I think I could think of, to end up in a nursing home. So do the things to prevent it. Look at my previous video on exercise and how exercise prevents it. Amazing that it's great that they're starting to see these things and bring it out in the literature. So till next time, start doing the things, prevent this disease. You don't want to have it.